They all happen at joints. What is dislocation? In dislocation, you realize that the joints normally move from their original position. What about sprain? Sprain, what happens is the ligaments or muscles normally overstretch. Sometimes it might be hard for you to recognize them. You may easily think that you're dealing with dislocation, and in the other hand, it is sprain. Or you may think it's sprain, and it is vice versa. It can happen also that you have a sprain and a dislocation. At the same joint, a fracture can also happen. Let's learn how do we use RICES as a mnemonic in managing dislocation and sprain. Welcome. Let's start with R. R stands for rest. What you need is to rest this injured area in a comfortable position. In a position that the person does not feel pain, or in a position that you don't feel pain. I stand for ice. You need to get an ice pack. Then with the ice pack where the injury is, then you need to apply the ice pack around that area. The reason why you're applying the ice pack is ice normally helps to manage pain, and also it helps to reduce swelling. So you apply the ice until that cooling effect. This person cannot feel that pain again. Then after that, you're done. The next is on C stand for compression. You need to compress the area with a bandage. And in this, of course, the elastic bandage works very well. Or the crepe bandage. How do you go about it? How do you go about it? Have the crepe bandage. Then you apply the pressure like this. It's not supposed to be too tight. It's not supposed to be too loose. It has to compress effectively. The reason why you're doing this, or the reason why you are compressing, is you want to prevent further swelling at the area. And this should happen after you've applied the ice. You're not supposed to massage the sides, because massaging the area it can promote more bleeding, and you realize that the following day the area of the injury has swollen. So avoid massaging. Just get the ice. After the ice, then you compress with a bandage. As you can see, what I'm doing or what I'm demonstrating to you right away. Here we go. Yes, and then this one you can just tuck it in, or if by the use of the pins, you can use the pins like this. Okay, you've compressed the area. This is to prevent further swelling. Then, what else do we need to do? After that, we normally say if the area, there's a lot of pain at the site, then there's need for us to also splint the area with, get something hard, either a piece of wood, and splint the area completely. And now let's talk about E. When talking about E, we say elevate the area. The person cannot just walk. If there's a lot of pain after you've splinted, this person cannot just walk that way. So what you need to do is you need to elevate the arm in the most comfortable position. For this, if it is the lower arm at the wrist, the most comfortable position, normally the hand has to be in this position. So you want to maintain this position. How do you do that? Using a triangular bandage. This is what you can do. This is the triangular bandage. You can see the shape of the triangular bandage. So what you do, place the triangular bandage like this. You have the apex. This is the apex. Normally, it's supposed to be at the elbow of the injured arm. Then have the hand that way. Then you can cross this on the other side. Then you can have someone try behind, okay? And that's how we elevate. You can, one way of elevating the arm. Then from here, then you can transport this patient to the hospital. Yes, thank you for watching. Keep following my channel for more videos on first aid. This is to help you. You never know when you need the skill. Thank you very much. C stands for compression. You need to compress the area with a bandage. And in this, of course, the elastic bandage works very well, or the crepe bandage. How do you go about it? How do you go about it? Have crepe bandage, then you apply the pressure like this. It's not supposed to be too tight. It's not supposed to be too loose. It has to compress effectively. The reason why you're doing this, or the reason why you are compressing, is you want to prevent further swelling at the area. And this should happen after you've applied the ice. That you're not supposed to massage the site, because massaging the area it can promote more bleeding, and you realize that the following day the area of the injury has swollen. So avoid massaging. Just get the ice. After the ice, then you compress with a bandage. As you can see, what I'm doing, or what I'm demonstrating to you right away. Here we go. Yes, and then this one you can just tuck it in, or if by the use of the pins, you can use the pins like this. Okay, you've compressed the area. This is to prevent further swelling. Then, what else do we need to do? After that, we normally say if the area, there's a lot of pain at the site, then there's need for us to also splint the area with, get something hard, either piece of wood, and splint the area completely.